came from the dark ages into the light when we got our Sectra RIS system, which was integrated with the PACS environment. And suddenly we were able to do things that we had only dreamed about before.
We knew we needed a system that could also utilize that MPI. And because Sectra was able to show us they could do it in the PACS, it was naturally assumed they could move that service to the front end and apply it to the RIS, and therefore our RIS and PACS would now be in sync.
Hi, I'm Mary Tierney, the Editorial Director of Health Imaging and IT Magazine, and I'd like to welcome you to today's vodcast, RIS PACS, Driving Standardization for a Large Hospital System, sponsored by Sectra. ProMedica Health System is a large and complex health system in the American Midwest. Headquartered in Toledo, Ohio, ProMedica serves more than 2.73 million patients annually through its 11 hospitals and 306 total facilities stretching across Northwest Ohio and Southeast Michigan. Each year, the system completes about 500,000 radiology exams. ProMedica was an early adopter of PACS technology, but it became clear that to provide 21st century high-quality care in radiology, they needed an integrated RIS PACS. They chose to stick with their PACS vendor, Sectra, and they were glad they did. A fully integrated RIS PACS now joins 7 hospitals, 26 imaging centers, and 3 radiology groups, and they have achieved their objectives of uniting a very complex environment through tight RIS PACS integration, standardization of exams, charge codes, protocols, and customized work lists for radiologists. The results speak for themselves. Turnaround time has improved greatly from 24 hours to 2 to 3 hours, and even instantly for emergency cases. Radiologists are happy, clinicians are happy, administrative and IT staff are happy. Let's see how they did it.
Having an integrated RIS PACS system in 2011 is a non-negotiable item. It's the same thing as having, a room with all the lights turned off. You can't be a radiologist if you don't have that.
The key goals that we hope to achieve with the RIS were, number 1, standardization across ProMedica. It is much easier to manage a system that is standardized than a system that is not. Integration was a second thing we were hoping to achieve, and the actual streamlining of all the processes within radiology to provide a quicker turnaround time for the patient reports.
Our turnaround time has drastically improved from the time an exam is completed to the time it was finalized by the radiologist. We used to average about 24 hours, and we've actually dropped down and reduced that turnaround time to 4 hours, which is huge for the clinicians.
We could read studies virtually immediately as soon as they had been obtained and give turnaround time that's so fast that we're telling the ER physicians the results of the tests before they even know that the test has been done. And that's very satisfying for us as professionals who want to deliver the right kind of care, but also it's very satisfying to them because they get the benefit of our opinions in a way that makes sense so that they can use them when they're making decisions. And they also can get patients in and out of the ER much more effectively and efficiently.
The nice thing was PACS and RIS could now be on the same workstation and work together. So in some cases, we actually gained a workstation because we can now use RIS and PACS on the same workstation.
It's quicker. Everything in the new RIS it's all on one page. You can seamlessly go through your link documents, look at patient demographics, reports, status. It's all right there rather than having to go into different fields.
The implementation took about 10 months to do, and it was interesting because it took us at least 3 or 4 months to get over our learning curve and understanding exactly what needed to be done to do this implementation. I almost think we were in denial for the first few months, not really realizing yet that we did need to standardize all of our exams. We did need to standardize all of our preps and instructions, and virtually everything needed to be standardized. And how we got to that was the key to the whole project.
The project that was undertaken has transformed our practice in ways that we sort of knew would happen and in ways we couldn't have predicted, all for the better. And, I definitely would go through it again.
I think the Sectra team that was assigned to our implementation was extremely flexible. There's a lot of stuff that they did that I am not even aware of. One of the huge items that they did were 7 facilities, and each one of those facilities has its own charge codes for each exam. And they had to take the RIS and adapt it to be able to accommodate 7 different billing codes for each procedure and one single order code coming in. So they did step up and they did make a lot of changes to the system pretty much on the fly to accommodate needs that we had here within ProMedica.
Sectra offered up a lot of resources. In the beginning, we have multiple different facilities that we send to. We have several different radiology groups that we send information to as well, radiology reports, results, things to that nature. Sectra is able to customize our interfaces in really any way that we want to. We probably have close to 50 different interfaces on the RIS.
We went live with the Big Bang theory. We took all facilities, all hospitals live on the same day. And to cover such a wide geographic area took a lot of feet on the ground. And Sectra stepped up. They sent us upwards of 20 different associates out of their headquarters to be here to help us with holding hands and troubleshooting as we went live for 1 to 2 weeks.
I got a phone call yesterday from a pediatrician who asked me to look at a case. I was actually working at our breast care center because I do some mammography. I went over to the workstation and I was immediately able to see the case he was talking about because it had been done, somewhere else in the system. So even though I'm at the breast care center, I'm looking at the case he wants me to look at. And right in front of me is all the information I need that was through the RIS. So I get the history, the text notes, and I'm able to help him even though I'm reading mammograms that day. So, he's happy, I'm happy, patient got the interpretation that they needed, and, things worked out. Prior to the current environment, that would have been simply impossible. I would have said, I can't help you right now, I'm over at the breast care center. That would have been the end of the conversation.
The time that the tech spends doing their normal paperwork, hard copy paperwork that they would customarily do, has been diminished. It's all computerized. They can start working on some of that hard copy paperwork now computerized before the patient even arrives. So it's really cut back on our tech time, and techs are very costly.
We can navigate through searches and monitor more what's outstanding, what needs to be verified, what needs to be read, what's missing, what didn't get done, how many are canceled for the day. We can see the live workflow process more real time than what we could ever see before.
Voice recognition has been great because it's part of that improved turnaround time. Being able to dictate, see your report, and sign off on it in real time, takes hours out of the process.
The new RIS has improved clinical practice in a couple of main areas. The first I like to speak about is cardiology. If the patient's going to be having some sort of heart surgery, some chest surgery, and the patient's having their workup for that, they typically, the ordering physician that's going to be doing the surgery sends the patient for a chest x-ray. He has that information from that chest x-ray available to him right away. Within seconds of our image being taken, he can see both new information and old information, images and all of the data then that's connected with those exams and all of the prior exams.
What has cut down are calling for results. We don't get that call as much unless it's from maybe outpatient services. But basically that has helped a lot. We don't have nurses calling and looking for reports, which is nice.
Recently, I've spoken to a referring physician. His bottom line was, I've never gotten my reports so fast in my career here at ProMedica. And so I asked him to explain that. And he said, well, there's another facility that we send our patients to, and we would typically hope for a 24 to 48 hour return. And so when I would bring back my patients, I wouldn't have a report to review with them. He goes, by the time that I would simply order the the exam, they would go down and get it and come back for their appointment, I would already have my finished product. He goes, that's remarkable.
I'm able to practice radiology in a way that makes what I have to say more relevant. But it's also gratifying to the clinicians who are saying, these radiologists are really contributing, and we really are glad they're there, and they do have something to add, and we can see that now. What more can you ask for?
A big objective of ours was a single vendor. We knew we had experienced in the past issues with one vendor pointing at another vendor saying, hey, it's not our problem, it's theirs, and vice versa. And having a single vendor eliminates that.
Our experience at ProMedica with Sectra has been probably in my opinion, one of the best experiences working with any vendor. They continue to remain committed, and they show it to us over and over again.
Productivity is through the roof. We had our first big jump when we went to a PACS environment, and then we had another incremental jump when we had the PACS RIS integration. So the days of sort of standing there looking at an empty screen because there wasn't material to interpret, those days are gone. We're there. It's real-time radiology, and before it wasn't.
Thanks for joining us. If you'd like to listen to this podcast again or recommend it to a friend, please visit healthimaging.com/Sectra.